from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. It is 6:24. New Year's is right around the corner, and it's time for all those resolutions, right? Well, the number one resolution every year centered around losing weight and getting fit. Baptist Health's Dr. David Gerson with Sherwood Family Medical Center is here with great advice for succeeding with those resolutions. We were just talking, it is the number one. You have people coming to your office all the time that are overweight and have this particular resolution.
Yeah, absolutely. And it's the number one thing we see in the office every day. We talk about smoking, we talk about drinking, we talk about exercise. Weight, obesity is the number one health problem that we see.
And there are some things you can do to make that resolution, to stay fit, to get healthy, to lose weight, make it stick longer than through February.
Yeah, consistent loss and keeping it off is what's important. And what we did is we looked at studies across the board as far as all the physician-supervised weight loss plans that are out there, and there were some consistent habits that people had where they were able to lose weight and keep it off.
Okay.
You know, the first one was eat breakfast every day. And that actually seems to be one of the toughest things for me to get my patients to do, because the American culture is sort of like, you know, get up, run out of the house, grab a donut, grab a latte, and you're not eating breakfast. That is actually the most important meal of the day, just like your grandma told you. Second, we want to make sure that you're exercising. And this is also a tough one. The exercise in the study shows 60 to 90 minutes a day, 5 days a week. A lot of us can't do that. So we ask you, do something, start with something, about 10 to 15 minutes each day, and every week try to add a minute to that. That gets your blood, running, that gets your metabolism running, that gets you to burn those calories more efficiently. The other one we talk about is eat often and eat small, right? So you want to eat about every 2.5 to 3 hours. This tells your body that you've got plenty of calories and it doesn't have to store it, because your body's always just trying to store calories for the future. And so you have your breakfast at 6:30 or 7, you have a snack at 9:30 or 10, you have a medium lunch, you have a snack mid-afternoon, and you have a small supper about 6 or 7 o'clock in the evening. That brings on a tip later on is don't eat anything for 3 hours before you go to bed.
Before you go to bed. And when you're talking about snacks, you're not talking about a pastry or a candy bar.
No,
obviously,
no.
healthy
We're
snacks.
talking about a yogurt, we're talking about some cottage cheese, we're talking about a banana, some fruit, that kind of thing, that kind of snack to keep it going. And then the last of the 4 tips, which doesn't sound like conventional wisdom, is but actually weigh yourself every day. So we were told previously, don't worry about the scale. People who lose weight and keep it off, get that scale, put it outside your shower every day in your birthday suit, weigh yourself, it'll keep you motivated.
Okay, in addition to those, you have some strategies also to help stay focused on this.
Yeah, so if I can give you one tip that I want patients to do is when you're trying to focus on it, get a diet log, get a diet diary, go to the dollar store and pick up a spiral notebook, and wherever you are, wherever you're eating, whether it's something you brought from home or you're at a restaurant, write it down as you're eating it. What this helps you do is it helps to kind of give you another input into your brain of what you're doing and make you think about what you're eating and think, well, maybe I don't need that extra little side. Plus, when you do hit that wall, which everyone does, it lets you go back to your diary and say, where can I fix, where can I tweak, where did I kind of mess up or trip up, and make the improvements that you want so you can get that long-term weight loss.
And we're just about out of time, but very quickly, there's other options if you've done everything you possibly can.
Sure. So, people want a magic pill. There is no magic pill, but there are medications that your doctor can help you with to kind of jumpstart your program, get you motivated, get you on track. The other thing is there are surgical options. If you're 80 to 100 pounds overweight, surgery is an option. We try to wait for that to be last, but it is an option for you.
All right. Dr. David Gerson with Sherwood Family Medical Clinic. Thanks. Great advice. As always, time to start thinking about those New Year's resolutions. And if you have a question, you can always call the Baptist Health Helpline at 1-888-BAPTIST.